Hello, I'm Dr. Joshua Light. This video is to help you understand the instructions to follow after having undergone in-office balloon sinuplasty. First off, congratulations on taking a big step towards feeling better. After having the procedure, you may already notice better breathing, and now with unblocked sinuses, a sensation like air is getting into places you haven't felt before. For most patients, it's a gradual process that goes on over 2 to 3 weeks. During this time, your role in the healing process is important and will lead to faster and better overall results. You may have already been given prescriptions to fill prior to the day of your sinuplasty. It's best to bring the medications with you on the day of the procedure so that we can review them with you. In addition to the prescription medications, you'll also need to get over-the-counter saline spray, such as ocean spray, Afrin nasal decongestant spray, and sinus rinse irrigations. So, what do you need to do following your balloon sinuplasty? The most important thing to remember is to keep your nose wet. The lining of the nose and sinuses heals fastest when it's kept moist. Dryness can lead to crusting, which impedes airflow. So the more you use your saline spray, the faster you'll be breathing better. You can start the saline spray as soon as you get home following the procedure, and continue to use it frequently throughout the day, at least every 1 to 2 hours when you're awake. You likely will notice some nasal congestion, which sets in about 3 to 4 hours after the procedure. This is a normal rebound from some of the medication used during the sinuplasty. You can use the Afrin nasal spray, 2 sprays on each side, which will take away the internal swelling and open your nose back up. You should avoid frequent or regular use of Afrin though, and most patients won't need it again after that first application. As part of the regimen, you should start doing sinus rinse with saline irrigations the next day after the procedure. This can be done twice a day at first, and then once a day after the first week. The sinus rinse irrigation does a great job of washing out any crusts or clots that may accumulate in the nose. Don't be alarmed by seeing any blood when doing these rinses. That's normal and is designed to keep it from blocking your nasal passages. Most patients experience only minor discomfort following this procedure. We'll give you a prescription for pain medication just in case, but most patients never end up taking it. There are several precautions for you to follow immediately following the balloon sinuplasty. You shouldn't blow your nose vigorously for the first week, and if you need to sneeze, don't hold it in, just sneeze through your mouth. You can resume normal day-to-day activities right away, but avoid doing anything overly strenuous, such as exercise, for the first 48 hours. You can resume all of your regular medications immediately after the procedure, but if you take a blood thinner, wait 48 hours before restarting. Your first post-op visit is generally scheduled about 3 weeks after the procedure. At that time, I'll take a look inside and suction out any residual crusting that may have formed. Continue using the saline spray up until that office visit to ensure that the nasal lining stays moist and healthy. If you're having any problems, we're always here to help. Feel free to call the office and we'll address any questions or concerns right away. I look forward to seeing you.